This is WCCO4 News, Saturday morning.
If you're thinking of sprucing up your look for summer, there's a new way to give your face a life without going under the knife. Just ahead, we're talking with a doctor about Radiesse, a new non-surgical procedure that can take years off your looks. This weekend marks the unofficial start of summer. It's a time when many people think about enhancing their looks, but you don't need to go under the knife to get rid of wrinkles anymore. Dr. Christopher Tolan joins us now to tell us about a new injection that takes just a couple of minutes, and it can help take years off your face. Dr. Tolan, thank you for coming in. And who's our other guest?
This is Randy Groven.
Randy, thank you so much for coming in. Tell me about what this process is.
Radiesse is a product that's actually been available for about 6 or 7 years, used primarily for non-cosmetic indications, but as of December of this year became approved for injection of the soft tissue underneath the skin to help provide volume enhancement and improvement in lines and wrinkles on the face.
And how does this differ from, what are the advantages of this as opposed to other methods?
Well, the great thing about Radiesse is that it's a product that can be injected in the clinic with minimal downtime, minimal risk to the patient, so that they can leave and resume their typical activities in a short amount of time.
And I've heard of the product Restylane. By the way, we're not endorsing any of the products or any plastic surgery for that matter. She's a beautiful woman.
Thank you.
But how does this differ from something like Restylane, which we've heard about?
Well, Restylane is a very common product that I also use to inject as well as Radiesse. Restylane is a hyaluronic acid-based product that is possibly a little bit shorter acting than Radiesse. Radiesse gives you a little bit longer acting action underneath the skin and can really act to support the tissue a little bit more than the Restylane can. But both are good products.
Mm-hmm. Now, Doctor, go ahead.
Well, I was going to say, one other difference is there are some places that I will put Restylane that I typically wouldn't lean toward putting Radiesse. And that would be around the lip area, although I used it for several years in the lips, but just discontinued it.
Okay, well, Dr. Tolan is going to give Randy the Radiesse treatment during our show, and we'll check back a little later in the hour to see how the procedure went. I do want to get one close-up. I guess we'll do that first, and we'll keep track of that. Now, and you'll be, I see nothing wrong with her, but what is the project?
Well, in the past, we've actually injected Randy before, primarily in the little folds that develop here, and also we're going to add a little bit of fullness to the cheek area.
Okay, good. All right, well, now that we've got that, we're going to go on to some more news. We'll check back with you, too, in a little bit, okay?
Great.
Thank you.
John.
The procedure is complete. We're going to check back with Dr. Tolan and see the difference the Radiesse treatment is making on his in-studio patient. Plus, earlier in the show, we told you about a new cosmetic procedure that takes just a few minutes and can actually take years off your life, according to Dr. Christopher Tolan, who has performed the procedure on Randy. That's your name, right?
Yeah.
Exactly.
Very good.
Things move so quickly here. And we want to check in and see how it's done. So you applied it, and did it hurt? I mean, nothing. What do you feel?
We filled 2 areas, actually. We filled the folds here, and also we added a little augmentation to the cheeks, and I'll let Randy explain to you what.
All right. If you'll look to me, we'll get a shot of you on that camera. Yes. Actually, look right at the camera. Let's see if we can see the difference here. So do you feel anything during the treatment?
A little bit of pressure, but that's about it. You know, Dr. Tolan will say you're going to feel a little poke and then a little bit of pressure, and that's really it.
Okay. And did you notice? As you look in the mirror, do you see the difference?
I do.
You do.
I do.
And doctor?
Yeah, absolutely. Between the takes here, we actually went to the mirror. I treated one half, and then we looked in the mirror, and it was quite a noticeable difference, so we came back and treated the other half. And the other thing that we did is I added a little bit of local anesthetic to the second side, and that seems to reduce some of the discomfort that can be associated with filling, especially deep soft tissue.
All right. Can we get another shot? Bring up those two, that split screen there, and we can maybe take a look a little closer ourselves. There she is on the left, of course, is the shot we took before the treatment. We're getting a little closer. To be honest, I mean, she looks great in both photos.
I would agree with you, John. I think the hard part is she's smiling, and
okay, give us a smile. No, smile.
The pre-treatment one.
Smile. I see.
And what happens is that when you smile, these folds tend to become more noticeable.
Oh, I see.
And so if we were complete relaxation, I think you would really notice the difference in highlighting of the cheek area and also here. So.
All righty. And when you do one of these treatments, like what does it cost normally?
I think it varies geographically, but in the East Metro, we charge per syringe, and most people charge per syringe. It's $800 per syringe. That's your syringe. So we will either use all the material or we'll store it. If you go on to the West Metro, the prices may vary a little bit.
People who may be familiar with Botox, does that injection feel about the same?
Botox is a great material. Two different things. One's used to treat dynamic lines or things where there's a lot of mobility. Fillers really hit the areas that there's not a lot of mobility.
I meant the feeling to the patient.
I would say that the fillers tend to be a little bit more achy. The Botox, once you place it in, as soon as you remove it, you're done.
All right. Again, we're not endorsing anything, but it is an option you might want to check on if you're into that. Thank you so much. You're all set up now for the
I'm all set.
impress all the relatives at the Memorial Day weekend. Thank you all for coming in. And if you'd like more information on Radiesse, we put some links on our website. Just go to WCCO.com/links.